Hi everyone, my name is Abigail and I want to thank you for being here today. And I'm very happy to be here to present the work that we've been doing at Gillette Children's Specialty Healthcare as well as the University of Minnesota in regards to Rett syndrome. So I'll be presenting our work entitled Caregiver Reported Pain Treatment Practices by Pain Types in Girls and Women with Rett and Related Syndromes. And so to begin, I just want to give a little background and overview on Rett syndrome. So Rett is a neurodevelopmental condition primarily caused by mutation on the MECP2 gene. It is predominantly found in females. And so Rett is actually characterized by seemingly normal pre and perinatal development from ages of 1 to 3 years old, followed by a significant regression of skills such as purposeful hand movement, spoken language, and the development of gait abnormalities and hand stereotypies. And associated health problems are unfortunately often found in Rett, such as gastrointestinal issues, scoliosis, epileptic seizures, as well as breathing difficulties. So with these many health concerns that are present, there is strong reason to believe that individuals with Rett may experience pain regularly. But due to severe motor communications often found in Rett, it may be difficult to even identify, let alone treat pain in this population. So thus, our goal of the study was really to investigate the different types of pain experienced by girls and women with Rett. And furthermore, we also wanted to investigate common pain relieving approaches caregivers use to treat pain at home. So this is just a little bit more information about our participants. So we had a total of 30 participants in our study, all females. The average age of our sample was around 17 years old, and the majority of our sample had a diagnosis of Rett, so either classic or atypical. But we did have 4 participants who had a Rett-related disorder, such as CDKL5 or FOXG1. And then the majority of our sample also did have a GM-FCS level of 4 or 5, which indicates significant motor impairment. So then moving on to our methods. So our study team utilized the Dalhousie Pain Interview, or DPI, and was used to assess type and intensity of pain for participants via caregiver report. This is just kind of a plug moving forward. Because of the significant communication impairments with individuals with Rett, everything moving forward is caregiver reported and not self-reported. And so caregivers were asked to describe any pain that their child may have had in the last 7 days. And then researchers categorize this pain as either accidental, gastrointestinal, musculoskeletal, neurological, or other. And then we asked the parents to give a pain intensity rating for that pain. And that was rated by caregivers on an 11-point scale, 0 to 10. So 0 was no pain, 10 was the worst pain imaginable. And then we calculated a mean pain intensity score, or MPI, which was calculated by averaging those pain intensities for each type of pain before any pain relief was given. And then continuing on, we then asked caregivers to report any pain relief approaches they used to treat that pain. And so the pain relief approaches included distraction, local treatment, massage, relaxation, changing positions, comfort or physical closeness, stretching, mobility, or exercise, or other. And then caregivers were asked to determine how well that intervention relieved their child's pain using an 11-point scale, where here the 0 is intervention did not help at all, 10 intervention completely relieved pain. And then we calculated a mean pain relief score, NPR. By calculating, we averaged those pain relief scores corresponding to each treatment approach. So then using the DPI, we also captured chronic pain experience that our participants may have had. And then we also used the brief pain inventory, or BPI, was used to measure the extent at which pain interference occurred with activities of daily living. So then moving on to our results, we found that 23 participants, or 77% of caregivers, reported their child experienced pain in the previous 7 days. And of that pain, the 2 most common was gastrointestinal, with 15 caregivers reporting that, and then musculoskeletal. Then to treat gastrointestinal pain, caregivers most commonly use medication, followed by changing positions. And then to treat musculoskeletal pain, caregivers use changing position, followed very closely by medication use. And then we also found that 16 caregivers, or 53% of our sample, reported that they believe that their child lived with chronic pain. And then we also documented that 24 caregivers, or 80% of our sample, reported that pain interfered with their child's activities of daily living to some extent. And we found that pain most interfered with mood and mobility. And so the results of our study really do suggest, unfortunately, that pain is a very common and often debilitating problem for many girls and women living with Rett. And not surprisingly, we found that this pain impacted daily living. And we also found that both pharmacological and non-pharmacological pain management approaches were very common for caregivers to use in the in-home setting. And then ultimately, since we kind of acknowledge that pain is a common and debilitating problem, future research specific to pain and pain management practices for individuals with Rett is warranted. That's all I have for you today. So I want to thank our funding sources, and then of course a huge thank you to both my colleagues and research team, as well as our families and their daughters who participated in a research study, because obviously without them none of this would be possible. So thank you so much.